Not the sound your kids want to hear, but it could be in their future if you're not careful. So it's best to get an early jump on your child's dental care. We spoke with Dr. Blake Billups, who's seen a cavity or two in his time behind the drill. He says it's never too soon to start thinking about your child's teeth, even the ones that don't exist yet.
Before the teeth come in, wipe the gums, get the food and debris out of the child's mouth.
And you certainly don't have to wait for the first sign of those choppers to come in before getting your little ones used to taking a trip to the dentist.
When the child gets to be near the age when we need to start seeing them, we'll have the child come and sit and see mom or dad have their teeth cleaned. That way they're familiar with the environment. They realize that mom and dad go through it, and it helps them relax and helps them when it's their turn to be in the chair.
Some other good reminders. Don't put a baby to bed with milk or juice, both of which are high in sugar. And keep an eye on your child's overall diet. Foods high in sugar and starch can lead to major problems such as tooth decay and cavities.
Hey buddy, give me 5.
Make regular checkups a must. Dentists recommend every 6 months to correct problems before they get out of control and costly. Make sure the toothbrush your child uses is appropriate for his or her age. Those little mouths can sustain big damage from a toothbrush that's too large. And start off their brushing with just water. Fluoride toothpaste can be pretty harsh to a young one's gums and shouldn't be introduced until the child is 2 to 3 years old. But sometimes, even when you take all the advice, you still have problems. Take Kelsey, for example. Her baby teeth weren't coming out, so she had to have 6 removed to make way for her permanent teeth. To top that off, now she has to have braces. That's a lot for a child to go through. Kelsey's mom says the best way to handle it is to be honest.
They're going to be apprehensive, obviously. A lot of times when we took her to the dentist, they would bring her back and tell her what they were going to do, and I would let her know ahead of time before we went in somewhat what to expect.
Oh, and parents, it's best to stay in the waiting room and, well, wait.
Because the children do much better if the parent is not in the room, because then they're more apt to say, oh, please stop. My child would have said, oh, Mama, come here. And it did much better, because then she walked out and she was a big girl and they told me what they did and she did fine.
And by all means, keep the mood light. You want their experience to be as fun as possible, so make sure you find a dentist who is comfortable working with kids.
All right, we get a Scooby-Doo sticker.
By following this expert advice, you'll be putting a winning smile on your child's face for years to come. For Smart Medicine, I'm Lorraine Cachola.